Veganism is a slippery slope to an eating disorder. This was the view of expert dietitians when asked their thoughts on veganism. And look, I'm not here to preach to you about veganism today, but I am going to preach to you about the importance of re-educating health professionals to better support their vegan eating disorder patients. Veganism is the practice of abstaining from animal products, often thought of as a philosophy or a public declaration of one's values, morals, and lifestyle. Eating disorders, on the other hand, are serious mental health conditions involving a distorted relationship with food and the body. They are some of the most fatal psychiatric conditions and impact 1 million Australians. So, how are veganism and eating disorders linked? Veganism is often thought of as a form of extreme dietary restraint, a way to camouflage disordered eating in a socially acceptable manner. And in eating disorder treatment, patients are strongly encouraged to deviate away from veganism as part of their quote-unquote recovery. But what are the implications of this? My PhD project aims to untie the complex relationship between eating disorders and veganism. Waitlists for eating disorder treatment have completely blown out since the start of the pandemic. So having a robust tool to screen for eating disorder symptoms is crucial in ensuring the limited amount of treatment resources go to those who need it most. In light of this, I aim to develop and validate a novel eating disorder screener for vegans to clearly separate out those who do and don't need further support. My work so far has involved in-depth qualitative interviews with people, with vegans with lived eating disorder experience, and psychologists and dietitians. And through these interviews, I've learned that the key is understanding why someone pursues a vegan diet, not just what they eat. So this will be at the core of my screener. The outcomes of my PhD will be threefold. First, I will assist with the development of evidence-based diagnostic options in vegans. And in doing so, my project will, for the first time, allow for the accurate estimation of eating pathology in vegans. But most importantly, my PhD will help re-educate eating disorder professionals to better understand those most at risk for developing an eating disorder. So, in response to the expert dietitians, I say veganism does not have to be a slippery slope to an eating disorder. In order to provide the best care to these patients, we need to stop assuming and understand why they're at the top of the slope in the first place. Thank you.